Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. Thank you so much for joining us. And I'm delighted to have as my next guest Dr. Glenn Hudgens, family practitioner, primary care excellence. Dr. Hudgens, thank you so much for being here.
Happy to be here.
Dr. Hudgens, now tell me where your office is. Where are you practicing?
In Carmel, same position, same spot for 37 of my 48 years in practice on Carmel Rancho Boulevard.
Now, Dr. Hudgens, you've been in practice how long?
It's my 48th year.
48 years as a family doctor.
Correct.
Dr. Hudgens, that's amazing. Did you ever stop to calculate how many patients you've seen or taken care of?
No way.
Well, how many days a week do you work?
Nowadays, I work 4 days a week.
You work 4 days a week, and roughly how many patients might you see in a day?
Anywhere from 6 or 8 to 20.
Well, you've seen literally thousands. You've taken
Indeed.
care of many thousands of people since you went into practice. When is it, 62?
1962.
62. Well, Dr. Hudgens, family practice has changed a lot, don't you think, since 1962?
Medicine has changed a lot in general, not only family practice.
Family practice, medicine and surgery has changed dramatically. So it seems to be that not that many years ago, the family practitioner did everything. And I think in some small towns, the family practitioner still does everything. Deliver babies, minor surgery, takes care of the medical problems, etc.
Absolutely.
But then if we fast forward, there's a shortage of you guys now. Now, why do you think that is? Why is there such a shortage of primary care doctors? Even in a town like Monterey, which seems like everybody wants to live here.
Yeah, I'm not sure the answer to that. I've been asked that by hospital administrators and other family practice doctors. The compensation is probably a factor. Especially physicians make more money by working the same number of hours. And the family doctor, if he's, as you say, a full-time, full-range family doctor doing OB, has to go deliver babies all night, then get up and work all day the next day. So it's kind of tiring in that regard.
It's a tough job.
Can be. Can be. It was when I was delivering babies, which I did for 30 years.
Well, Dr. Hudgens, do you still have patients in your practice now that you delivered?
That I have delivered? Oh, yes, sure.
Well, that's amazing that you actually can deliver babies and then you help take care of that person literally the rest of their life.
We call it womb-to-tomb medicine.
Well, Dr. Hudgens, I tell you, there's not many like you left.
No.
There's not many remaining. Congratulations for hanging in there that long.
I don't think there will be any more like that either. I don't think any future practitioners are going to subject themselves to the responsibilities of a full range of practice. The reason I did was I started in a small town, which you just described, where the nearest consultant was 50 miles away. So we had to do everything.
Well, where was it that you started?
In Illinois.
You started practice in Illinois in 62.
1962.
And then you came to Carmel, Monterey when?
1972.
10 years later. Well, Dr. Hudgens, let's talk about a typical week for you as a family practitioner or a typical day. Now, I know you provide medical care, of course, to your patients.
Sure.
And I know you have hospital responsibilities. I know you help manage medical records, or you're on some special committees at the hospital. Now, don't you also help to provide medical care for some of the skilled nursing facilities on the peninsula?
One skilled nursing facility, Canterbury Woods, which is not only a skilled nursing facility, but it's a retirement facility. They have full-time permanent residents who live there. And as a part of that facility, they have a small unit of nursing care, full-fledged nursing care for inpatients.
And so how many doctors do you sort of partner with or colleague with to provide?
There are 2 other physicians beside myself. And we're on site half a day, each of us, 1 time a week. So there are 3 half days that they're covered.
So that phrase you used a few minutes ago, womb to tomb, like you have actually delivered many babies in your time, and you take care of youngsters and teenagers and adults, and also you do geriatric medicine. That's really amazing, and I think it's potentially hugely emotionally rewarding, don't you think?
Indeed, absolutely is. When you can follow a family. I always thought OB was the most fun of any part of medicine because you start with 2 healthy people and end up with 3, as opposed to starting with 1 unhealthy person and ending up with none on occasion.
Now, Dr. Hudgens, do you still go to the operating room? I used to see your name on the schedule at community hospital a fair amount. Now, I don't know if you're still operating or...
Not very much anymore. So I did a lot of surgery for the first 35 years in practice and much less. I've wound down gradually since that time.
Well, when you talk about your first 35 years in practice, that still astounds and amazes me. Are you going to hang in there, and are you enjoying working, and you
Still enjoy what I do and plan to continue for a while.
Well, Dr. Hudgens, that's great. But you know, the $10 million question is, are you taking new patients?
I still do. Not many anymore, but on occasion, on referral from other physicians. When I want to refer somebody to another doctor, they don't hesitate. For you, for example, if I sent you a patient, you wouldn't say, I'm not taking new patients. You'd say, thank you for the referral. And when other physicians refer patients to me, then I accept them.
But Dr. Hudgens, besides your private practice, and then you also help over at Canterbury Woods, I know you have some hospital responsibilities, right? Can we talk about that for a few minutes?
Sure.
So how is it that you help manage or administrate or supervise the hospital?
My title is Director of Utilization at Community Hospital, and I've been involved in things like that for at least 25 years. I was on the Medical Records Committee for a long time and what was called the Utilization Committee for a long time. And currently, as Director of Utilization, I meet with utilization nurses and discharge planning nurses twice a week and review charts at their behest and act as a middleman between them and practicing physicians to help to properly utilize medical beds so that people neither are discharged too soon nor kept beyond the indicated length of stay.
Well, Dr. Hudgens, that can be kind of a tough job, I think, because it may be, sometimes an insurance company may be tugging one way, sometimes their primary care doctor may be tugging another way, and the patient, I know, sometimes feels kind of caught in the middle. Isn't that right?
I don't think the patient feels it that much. The doctor feels it, but I don't think anybody puts the responsibility onto the patient. They're just kind of the end result. Either the insurance company says, it's time to go home, we're not paying for you anymore. The doctor can convey that to the patient. And usually it's with justification. There are standards for which all of us have to, by which all of us have to abide for length of stay and utilization of specialized services, imaging services, laboratory services, surgical services.
Well, Dr. Hudgens, you know, we can barely pick up a newspaper these days and not read about the ongoing healthcare debate. I think I'm going to ask you to come on the program another time and give me your perspective as a almost 50-year veteran of the medical world. I'd like to get your perspective maybe another time because we only have a few more minutes. You know, I want to bring up the emblem I see in your jacket, 100th U.S. Open, Pebble Beach. Now, I know you're involved with getting the U.S. Open at Pebble Beach some medical coverage. Isn't that right?
That's correct. Both the U.S. Open and the AT&T National Pro-Am at Pebble Beach.
So you help coordinate the medical team for those events?
I do. I'm the medical director, or the chairman of the medical committee of both events, the U.S. Open and the AT&T Pebble Beach National Pro-Am, which was just concluded in the last 2 weeks. My job is primarily to be sure that the first aid stations are stocked with equipment, which is supplied by a community hospital, by the way, and to register volunteer doctors and nurses and assign them to the various stations so that we have coverage through both events. Through the AT&T Pebble Beach Pro-Am, there's a first aid station at each of the 3 golf courses that are used, Pebble Beach, Spyglass, and this year Monterey Peninsula. At the U.S. Open, we'll have 3 stations, but they're all at Pebble Beach because the same size crowds that are spread over 3 courses for the AT&T Pebble Beach are now all on one golf course at Pebble Beach for the U.S. Open, which is June 14th to 20th this year.
Coming up, June 14th to 20th. So you'll be out there coordinating the medical care.
Right, and a lot of other doctors and nurses helping me.
Well, Dr. Hudgens, that's a great community service, and we appreciate you doing that very much. Now, let's return to your private practice. What's your average day like? Do you do procedures in the office? Do you see people who are calling for kind of an urgent appointment? Do you have routine follow-ups? What's your average day like?
I start with a trip to the nursing office to look at the admissions of the day before and see what kind of beds are available in my job as director of utilization.
So that's at the hospital?
That's at the hospital.
So typically you start your day up at community hospital?
7 days a week, 365 days a year. If I'm out of town, I do that by telephone.
You check in with that office 365 days a week?
A year.
Excuse me. You check in with that office 365 days a year?
I do. And then there's a notice that we post within the hospital about the situation for that particular day, whether beds are readily available, whether they're a little scarce, or whether there's a shortage or a critical shortage requiring earlier discharge and prioritization of admissions. Occasionally, the place is full, and somebody who needs a bed, there is no bed. And that's my job to help sort that out.
Day in, day out. Well, Dr. Hudgens, I tell you, I've got to salute you for your dedication and your willingness to take on responsibility. It's a great community service. So that's where you start your day off.
Right.
And then do you go to the office?
Go to the office from 10 to 12 and again from 2 to 5 and see scheduled patients, emergency patients. We can get emergency patients in the same day, always. We just accommodate our schedule to, or change our schedule to accommodate that.
Now, are there certain times when you're jammed in the office, or certain seasons, say cold and flu season, or other times, summertime, when people are getting injured, or are there busy times and not so busy times?
Yes, there are, but they're completely unpredictable. I used to think that wintertime, when the flu season was upon us, was a busy time, but there are other times it's just as busy.
Well, Dr. Hudgens, what are some of your favorite either procedures to do or operations that you have done, or do you like to manage, say, hypertension, or do you like to see people with cardiac issues? Do you like to see children?
I don't see many children anymore. Since I stopped delivering babies, people don't bring their kids in to see me, and I don't get a lot of middle of the night calls about earaches, so I sleep better. I did surgery for 30 years, as I said, mostly, I guess, primarily GYN surgery. I did hysterectomies and cesarean sections and pelvic surgery, and still did hernias and gallbladders and things like that for many years. Now I don't do much surgery anymore. I turn that over to people that can do the hernias laparoscopically, and the only way I was trained to do it was with open surgery, which is a big incision and longer recovery time and more discomfort.
Well, Dr. Hudgens, so for about 30 years, did you say, you did gallbladders and hysterectomies and cesarean sections, did you say?
I did.
So how did you learn how to do that? I mean, was that part of your training?
Part of the training was in surgery, but on-the-job training in this little town in Illinois, I went into practice with a full-fledged surgeon, much older man by then, who he was very instrumental in helping me, being at my side through the first couple of years until I was sure of myself.
Did you enjoy operating? Do you enjoy
yeah,
it?
I did, because that's when you can do surgery and take out a gallbladder and somebody was sick and now they're well, that's very satisfying, as opposed to treating long-term medical illnesses in which you're trying to maintain and not cure, as, for example, the hypertension that you mentioned.
Right. So it seems to me that there would be tons of medical students who hear about a practice like yours, or the ability to deliver babies and take out gallbladders, as well as manage hypertension or see people with heart and lung problems. They would be really attracted to the field. But it seems like we have a lot of problems convincing or inducing medical students to go into family practice these days.
That's true. And in addition to the reduced remuneration that I mentioned earlier, there's liability issues. And one of the reasons I quit delivering babies was with the liability, the insurance premium, liability insurance cost went sky high. And the attitudes over the years have influenced that. Initially, people thought their doctor would do the best he could, and they expected him to do the best he could, and expected that occasionally you would get a bad result. Then it morphed into the opinion that if something went wrong, it was somebody's fault. There was no longer the accidental child who was born with deformities due to unknown causes. It had to be somebody's fault. And so lawsuits followed, and I was never sued, but many people have been, obviously.
Well, Dr. Hudgens, I'm still amazed to hear about your career. And what about sitting down with people who have tough medical problems or who get a difficult diagnosis after a biopsy? Is that a tough part of your practice, to be able to sit down and talk over these things?
Absolutely, but it's necessary, obviously. And I try to be empathetic and feel how I would feel were I sitting in their place getting this information.
Well, Dr. Hudgens, you know, it strikes me, I have to say again, that throughout the course of your career, almost 50 years as a practicing physician, for you to deliver the baby and then help take care of that child as he or she grows up, and you could coach that young adolescent through difficult teen years right into adulthood. I mean, you literally can help take care of a person for most of their life.
True.
I think that's amazing.
Well, it's the way I learned to practice medicine.
Well, Dr. Hudgens, I tell you, there are not many guys like you. We are so lucky to have you around, and you're liking your job. You don't have plans to
Not
hang
in
it
the
up.
immediate future, no. I still get to play golf a couple times a week.
So you do play golf twice a week?
I do.
Is it Wednesday afternoon and another? Oh,
And
man.
the weekend.
Well, Dr. Hudgens, I tell you, I've got to salute you. I'm supposed to be biased, but I know you're such a hard worker, and I see you at the hospital being very diligent, and you're a true asset to the community. Thanks very much for being around.
Well, thanks for having me.
And I'm going to invite you to come back another time, and maybe we can talk healthcare politics.
I'm not much of a politician. I think you can find other people to be more informative in that area.
Well, Dr. Glenn Hudgens, family practitioner right here in Carmel and Monterey, we certainly appreciate you coming on the program, and thanks for all your community service.
Thank you, David.
Once again, I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. We're going to come right back after a very brief pause for a very good cause.